All right, today we're going to talk about something fundamental. Those key numbers that tell the story of your health, your vital signs.
So, what are these signs really telling you? I mean, you hear about them every single time you go to the doctor, right? But what do they actually mean? It's time we stop seeing them as just, well, numbers on a chart.
A much better way to think about them is like your body's own personal dashboard. With all these essential gauges that show you exactly how your internal engine is running. So let's pop the hood and dive in, starting with our very first gauge.
First up, the thermostat, also known as your body temperature. This one's pretty straightforward. It tells us if that internal engine is running too hot, too cold, or, just right.
So what is body temperature? Well, it's basically the degree of heat your body is maintaining. And it's this constant, incredible balancing act. Your body is always producing heat, from metabolism, from exercise, and at the same time, it's losing heat to the world around you. Your temperature is just the result of that equation.
And this is the number we all know, right? 37 degrees Celsius or 98.6 Fahrenheit. That's kind of the gold standard, the average set point for a healthy adult. But, and this is super important, that number is not static. It's not set in stone.
Actually, it's changing all the time. Your temperature is usually a little lower in the morning. It'll go up when you exercise or if you're stressed out. Even what you eat and drink can affect it. And for women, the menstrual cycle plays a role too. It's a really dynamic number.
Okay, so that's the thermostat. Now let's move on to the next gauge on our dashboard, the engine itself. We're talking about your heart and the speed it's running at, which we measure as your pulse.
So what is a pulse exactly? Well, every single time your heart beats, that powerful left ventricle, it's a real workhorse, sends this big wave of blood surging through your arteries. And that little thump you can feel, that's your pulse. It's a direct line to what your heart is doing.
So, what's a normal speed for this engine when it's just idling, at rest? For most healthy adults, you're looking at somewhere between 60 and 90 beats per minute, or BPM.
And the cool thing is, you can check this engine speed yourself, anytime. You don't need any fancy gear at all, because you can feel it wherever an artery gets close to the skin.
Yeah, check this out. The most common spot is right there on your wrist. That's the radial artery. But you can also find it really easily on the side of your neck, that's the carotid, or even up on your temple.
And just like your temperature, your pulse is super responsive. It naturally tends to slow down a bit as we get older. It speeds up with exercise or if you have a fever. And it definitely reacts to how you're feeling. Fear, anxiety, stress. Even some medications can turn that dial up or down.
Okay, so we've got our temperature and our engine speed. Next up on the dashboard is the gauge for your fuel system, which is all about your breathing.
Yeah, you can really think of this as fuel delivery. The respiration rate is simply the number of breaths you take per minute. But what it's really measuring is how well your body is getting the oxygen it absolutely needs to power every single cell.
So when you're just sitting around, a healthy adult is usually taking about 14 to 20 breaths a minute. It's a good sign that your lungs are doing their job without having to work too hard. And no surprise here, just like the other vitals, this rate is not fixed. It's going to change with exercise, if you're sick, or even with strong emotions like excitement or stress.
All right, that brings us to our final main gauge on the dashboard, the pressure system. This one tells us all about the force that's moving through your body's, its vast network of internal plumbing.
So here's the deal. As your heart pumps blood out into your arteries, that blood pushes up against the artery walls. That force, that's what we're measuring when we talk about blood pressure. But here's the key thing. It's not just one number, it's actually two.
And understanding the difference is actually pretty crucial. You've got the top number, that's the systolic pressure. Think of it as the peak pressure right when your heart squeezes and contracts to push the blood out. Then you've got the bottom number, the diastolic. That's the pressure that's left in your arteries when your heart relaxes between beats.
So what are we aiming for? Well, the general target for a healthy adult is right around 120/80, and you'll see it written as mmHg, which stands for millimeters of mercury. It's kind of a fun little historical fact. It's a holdover from the old-school mercury-based gauges. And this is how they get that reading. They use that inflatable cuff, the technical name is a sphygmomanometer, and it gently squeezes to temporarily stop the blood flow. Then, with a stethoscope, they listen for the very first sound of blood returning as the pressure is released. That's how they find both the systolic and the diastolic numbers. Okay, so we've looked at all the individual gauges on our dashboard. We've got the thermostat, the engine, the fuel system, and the pressure. Now let's put it all together and see how to read the full report.
Right at the center of this whole dashboard, you have the heart. It's the engine, right? It's what's driving your pulse and creating that pressure. And its workload, how hard it has to work, is directly tied to your body's temperature and its constant need for oxygen from your breathing.
And this is the most important thing to remember. None of these gauges work in isolation. They are constantly talking to each other. For example, a fever raises your temperature, right? Well, that makes your heart work harder, which raises your pulse. Stress can crank up your blood pressure. They are all interconnected. So when you look at all four together, your temperature, your pulse, your blood pressure, and your respiration, you get this incredibly fast, incredibly powerful report on your body's overall function. There's a reason it's the first thing a doctor checks.
So, what's the bottom line here? Your body is talking. The real question is, are you listening? Because these aren't just numbers for a medical chart. They're signals. They're messages from your body telling you how it's doing moment to moment. And you know what? Understanding them is the very first step in taking charge of your own health.